And sorry for the weird view, but I didn't want to show the patient's face, so I wanted to show you how to do kinesiotaping for the shoulder again. A little different than last time in my other videos, but I picked up by muscle testing. If you could just relax your arm right here, grab on though to each so that it's relaxed. When I use muscle testing, and it's kind of an interesting technology because you can reproduce this every time. As I look at my thumb. And when I pull the tissue up this way, it likes it. So how I tested this here, it locks, and the patient can feel that I can't really pretty much go further. Can you see that it goes further than this point right there? How it locks in place. Can you feel that? I mean, if I try to go further, it doesn't really let me go too much further, right?
Okay.
Can you feel that? Can you feel the block or not?
No, I don't know what you're doing.
Okay. Patient's very honest. I like that. I'm feeling a sudden block in the tissue. Basically, it won't let me go further than this. And sometimes the patient can feel it, and sometimes it can't. And on screen, it just locks right there. And now if I pull tissue up this direction, it allows the tissue to go on the arm further. See, it kind of unlocks. Okay. And you can see that on the screen. You could see also when you see the video, okay? But before I touch it, it locks really quick, and no matter how hard I push, it doesn't go any further. But then when I do this, kind of unlocks the tissue, okay? So that's the direction I'm going to put the kinesiotape. It also does it down here too. When I pull down the tissue here, it unlocks. So I'm going to do a kinesiotape that goes this direction, but the pull is this direction, so I have to start it up here. So I'm going to start the tape here, run it down this way, and I'm going to do a fairly good pull on it. It's going to be a kind of a complicated tape because you want the ending to be where you're extending your position of your shoulder. So let's practice that for a second. The shoulder needs to be down this way and then maybe down this way. That's probably what I'm going to do. I'm gonna have you stretch it and reach for the floor, and that way, and then bring your shoulders back, and that's the position that you're gonna apply the tape in, because you got two different lines of field, two different planes of action here. You got this muscle here and this muscle. Generally, you want to stretch the muscle before you apply the tape, so that when you're when you're doing things around the house, it allows it to be more functional. Meaning, for example, if you shorten this like this, and you apply the tape at this point, well, as soon as you bring your shoulder back, it's going to feel a strong stretch. Does that make sense? So generally, you want to put the tape on with the shoulder fully stretched, or whatever part that you're doing, and then apply the tape. So that's the way I'm going to do it, from here to here. So I'm going to cut a pretty long piece of tape. You're looking at about 9 blocks of tape here. You can't go wrong by going a little further, meaning getting a little bit more tape. So I'm going to cut 9 blocks off of here. 1, 2, 3, 4, 5, 6, maybe more. It's like 7 blocks, because you're gonna tape it, and the tape always stretches. So I'll do 7 blocks. Now, in his situation, I'm probably going to put some. I'm going to put some adhesive on there. Okay, so I applied, I'm going to put some adhesive, which is this right here, New Skin. It's alcohol based, and I'm just going to go ahead and turn your head while I do this. I'm just going to apply it, it's going to be cold, along the passageway of his kinesiotape. As you can see, I draped some paper there, because it's easy to get off, but still you don't want it to get on anything else besides the patient. And I like to kind of, if I put too much, you can get it at Amazon, you can get that, kinesiotape and the New Skin on Amazon. And then if I put too much, I kind of like absorb it a little bit with paper, so that when it gets tacky, that's when you put on the tape. Okay, so now remember, you take off the ends of the tape. For this situation, you're gonna You're going to stretch it down from here to here, and I'm gonna start here though, because it's gonna pull it this direction. So when you put it on, I'll show you what I mean. You're gonna rip the end. Okay. And I'm gonna put it down here. And so I'm holding it out, and I'm gonna basically rub it down. Remember, heat activates it. And I'm gonna take the rest of the taper off now. This is where it's important to hold it in like this. Now he's gonna stretch his arm now. Okay, down like this. Let's rotate his palm forward because you're gonna stretch out this pec muscle here. And he's gonna reach for the floor and rotate his arm out. So it's going to do external rotation. Now I apply a stretch. This is where all the therapy is. If I can stretch that real hard or real soft, that's the art. Okay, you're going to stretch it out 20 to as much as 100%. I don't do 100% too much, but in this case, I want to, I'm going to do probably 20 or 30% stretch. So I'm stretching it about 20 or 30%, and then ended up right there. Take the end part without any stretch at all and just drape it down there. And then in the meantime, you're gonna basically you're gonna rub it. So now he's done. Once I rub it, then I'm gonna go ahead and this should stay. There was no adhesive right there, so it may come off. But if it does start peeling off, you just go ahead and cut that off. Okay. So now, notice I did some cupping right there. Now when he takes this off in 3 days, sometimes you do get bruising with the cupping. You'll notice that when you take the tape off, there is no bruising underneath the tape, or less bruising, because it does such a good job in taking away inflammation. And that's the goal of the tape. In this particular situation, it helps to drain and take away inflammation. And in this case, I'm going to reduce muscle spasm in this muscle right here. And then also reduce muscle spasm in this muscle right here, because I'm pulling the muscle down this way. So there will be the deltoid here and the pectoralis muscle right through here. And that's it for the kinesiotape for the neck and shoulder. I will see you on the next visit.